everyone, this is Khushbu from Dr. Behind the Scenes, and today we have a live which is like extremely important, and I'm so excited about this because the information on the internet is so less that I'm blessed that we have our guest Dr. Kaviya with us today, and she'll give us the whole scoop, the insight, the total insight about this life. And because she has been to Canada, she has given all the steps as an IMG, she'll be able to help. Guys, we did this session on our Instagram, and these are some reviews by our audience. They absolutely loved it, and I'm sure that if you keep watching, you'll love it too. Hello, hi
Hi,
Dr.
Kushbu.
Kavya. How are
Hi, how are
you?
you? I'm good.
I'm
How are you?
fine. Small Instagram glitch, I believe.
Oh, yeah. Sorry about that. Yeah.
No, no, that's not an issue. So, uh, introduce yourself. I'm just so happy that you are here and somebody from Canada who's been to
hmm
Canada, who's done all of this, who has experienced everything in Canada as an IMG is
hmm
here.
hmm
And I would love for you to introduce yourself.
Sure. Thank you so much for having me. And I was watching since the beginning. I was watching the live, but I was not able
Yes.
to join the live. So, yeah, I'm Kavya, and I was born and brought up in India. And I also finished my MBBS here in Tamil Nadu in Trichy Government Medical College. And I graduated in 2014. So once I graduated, I moved to Canada because I got married and my husband was there, so I moved there. And yeah, since I went there, I started working on the IMG process and how to practice medicine in Canada. And
Right.
then, I tried applying for residency as well because to get a license, practicing license in Canada, you need two things. One is the exams, which is conducted by Medical Council of Canada.
Right.
And then once you are done with the exams, then you have to do a residency training program.
Right.
So once you are done with both, you will be able to apply for an independent practice license.
Right. We'll talk about all of these later.
Definitely.
Le let's talk about your journey. Like, how were you as a medical student? Were you always a topper or a backbencher? Did you know that you'll go to Canada for your PG? How did it happen?
Yeah, sure. So I was a studious student for sure because even in school I used to be a topper and I got into one of the government medical colleges. But I am
Right.
not a topper in my medical college. I was a good student. I didn't have any breaks. I studied well and I gave all my exams in my first attempt and I did a good job, but not a great job, I would say.
I
So,
think you
but
did a great job.
Oh, thank you. And I was not, I knew a year before finishing my MBBS that I'll be going to Canada. So I tried getting information about the process before I started my journey there, right? But
Right.
it was really hard because it was back in 2014 and we didn't have much information like we have right now. And so it was really hard. It was hard to find even people who are already in Canada, like practicing medicine. And there were a
Right.
lot of doctors in US, and even my college seniors used to give USMLE exams, and they used to go to US. And I even knew people from UK and Australia, but for Canada, there were none.
So
So
you had to
yeah,
fly to Canada to know all
yes, that's
about
what,
the.
yeah. Then I was like, okay, I'll just give a pause. And then because I had my wedding as well, so I thought I'll just finish everything off and then I'll go there and like start my process.
Right.
Yeah,
So that's great because for us, you will be able to answer all our doubts now that you have
definitely.
been
Yeah,
there.
yeah.
So, now that, so you told us that so in the last year, you knew that you will be going to Canada. So,
Yes,
did
yeah.
you do any special, like anything that to build your CV or anything extra to get an edge over the other students?
Honestly, no. I would say because I was a very punctual student and whatever I do, I did sincerely in med school as well. So when I did my internship too, we get a certificate, internship certificate, right? So
Mm-hmm.
since I didn't have much knowledge about Canada, what I did was all the other students who went abroad, they used to tell me that okay, just try to maintain like a good contact in your college, and even during your internships, try to be very good with your professors, because we do get marks for the internships as well in each
Oh, all
department.
right. Okay.
So that was the advice I got from seniors, but I didn't knew if it would be helpful for
Right.
Canada, right? So I just
Right.
made sure I did my part because I didn't know what else to do. And luckily, I was able to connect with one doctor in Canada, but I was not able to talk to them or, like get more information. I was just able to email her, and all I got, the information I got was I have to do the MCC exams and then take it from there. So that's the only thing
All
I
right.
knew. So then I went to the Medical Council of Canada website and then tried to gather some information, but it was all too like complicated, and I was not able to find the proper, like, straightforward process. So I was like, okay, you know what? I'll just do my part here and then go and
Right.
see what's going on. Yeah.
Right. So now that you moved to Canada,
Mm-hmm.
is it the same for every student, like foreign medical students, like Indian students who are studying in Ukraine, Russia, or say Philippines and other countries, and Indian medical students? Is this the
Yeah.
only pathway to go to Canada?
So, as far as I know, for Indian students, it's the same pathway. And even if you do your post graduation as well, it doesn't matter if you're a fresh graduate, if you have clinical experience, or you're a specialist, everyone has to go through the same process.
Same process. All
Same
right.
process, yeah. So we have two pathways in Canada. Like when you apply
Okay.
for a residency program, you can choose two pathways. The first one is the most common one, which all most of the students use, because fresh graduates are allowed to apply through that process, which
Mm-hmm.
is CARMS. It's known as
Mm-hmm.
Canadian Residency Matching Service.
Okay.
So I will give you all the links once we are done with the live,
Right.
so that you can,
Sure.
if you're posting it, you can also add those links. It's because you
Yes,
will
yes.
hear a lot of new terms,
Yes.
and it's hard to just catch in one live session. So I'll share all the website links with you so you guys can go ahead and like have a look.
Right.
Okay, so the first process is CARM. So that's the residency process which most of us go through, because
Mm-hmm.
it's for fresh graduates, and even without clinical experience, you can apply for the process.
All
And
right.
the other one is called as practice ready assessment.
Mm-hmm.
That's pretty shorter process, but it's applicable only for people who have independent practice. So either
All
minimum
right.
requirement will be, it depends on the province as well. So where you apply, so it has a requirement for each province, and so that doesn't. I didn't touch that pathway because I was not eligible for that.
All right.
Yeah, so
So
I
we'll
can give
talk
the link
about
for
this.
that too. Yeah. Yeah,
Sure.
so we'll talk about the CARMS process because I think most of the people go through this one, and most of them are medical students as well, right?
Right. So,
Yeah.
for sitting in the CAMS process,
Hmm.
did you have to do like what were the requirements for the eligibility? Only the internship should be there, or without
No,
internship
you
also?
have a lot of things to do before you apply for a CARMS matching, because
Okay.
CARMS itself is like it's a residency program matching service. Once you have
Mm-hmm.
all your application and your exams, everything ready, only then you'll be able to apply for CARMS.
Oh, okay.
Yeah.
So, before giving the licensing exam, what are the
Mhm.
what is the eligibility and requirements for this? Could
Sure,
you
sure. So the first and foremost thing is we have to make sure our college degree is recognized by Canada.
Mm-hmm.
And Canada usually follows a list from, it's called World Directory of Medical Schools. So once
Okay.
you go there, and you can check if your college is there on their list, and if it's
Right.
there, your degree is recognized.
Okay.
So that's the first and foremost thing. So once you know that your college degree is recognized, then you have to open an account in physiciansapply.ca. So
Okay.
it's a portal, online portal, and
Mm-hmm.
it's more like the ECFMG. If you are applying for the US process, you have that ECFMG
Right,
portal,
right,
right? Online portal, right? It's
right.
similarly, we have Physicians Apply in Canada, and then you have to go open an account in the portal, and then you will have to give all your degrees and everything. You have to get your documents verified there. And
All right.
so
Okay.
only after you get your documents verified through the Physician Supply portal, then you will be able to apply to the exams.
Oh, all right. So
Yeah.
what is the what is included in the ECFMG process? What are the documents that are needed?
So usually it's the routine, like your medical degree, your internship certificate.
Okay.
And so there are two documents which we Indian medical students usually don't have in our medical colleges,
Oh,
which is medical trans. I'm not sure if it's the same with all the colleges. My college didn't give me medical transcript and MSPR, which is called as medical student performance record.
okay.
So these two documents are not usually issued by the Indian medical schools.
Mm-hmm.
So we have to get these ones ready and get it signed from the dean.
All right. Okay.
Yeah.
So these are the main documents that are required other than other
Yeah,
so,
probably
right.
they will ask for your passport and all those other stuff for your personal
Okay.
identification, but mainly these things.
All right. And before going to Canada, we have the whole visa process. So if you could give a
Yes,
little
yeah,
insight. Yes.
sure. So to apply for a residency program, you either have to be a Canadian PR, that's a permanent resident,
Mm-hmm.
or a citizen. So, you have to have your citizenship.
Right. Even if you are an
Yeah,
IMG.
even if you're an IMG, you
So
either have
how
to have
do,
either PR or. So since I was married to, like my husband was already there, so I
right.
went there. Initially, I went as a dependent for him because he was working there, and then
Right.
I changed my visa into a work permit, and then from there we both applied for PR together, and so I
Okay.
was able to get a PR as well. But he was the main applicant, so I was
All right.
an add-on applicant with his application. And once you
Okay.
get your PR, you can do all the exams without your PR, but you need your
Okay.
PR to apply for residency.
So these exams can be given in India itself, or we have to go to Canada to give this?
So the first exam can be done in India, like the Medical
Okay.
Council of Canada qualifying part one. They
Okay.
have centers. I think they have more than 80 centers around the world, so different
Oh,
in
all
different
right.
cities. Yeah,
Okay.
so
That's fine.
you can take the exam if you have a center nearby your place. Then you can take the exam before going to Canada.
Okay. So what
Yeah.
about OSCE, like the part two? Can
Os
we?
OSCE, you have to be there. You have to be
So
there
we
in
have to.
person because they conduct in hospitals. I don't know how the process is right now because of COVID, but I think they have virtual exams right now. But for OSCEs, if not, you have to be in Canada in person to do the exam.
Right. So, about getting the visa, is it easier for IMGs to get the PR, or is it difficult? And what are the other circumstances in which one can get a PR?
So usually, as far as I know, when compared to other countries, getting a PR as a doctor in Canada is much easier, because it's
Okay.
all based on point system. Since I didn't go through the process myself, I am not going to tell you everything about PR process, because
Right.
everything is online. Like you can go online and all the information is there. It's more based on point system. They look into your bachelor's degree, and then if you have any work experience you can add that, and they ask for your English test. So it
Okay.
keeps the points keeps increasing with the level of education you have, the scores you have in your IELTS, and your work experience. And if you're married and if you're like applying with your spouse, their points add to your application as well. So it's considered as a
Oh,
whole.
all right.
So yeah, so but most doctors don't have an issue getting a PR when they apply for Canada.
Okay. Oh,
Yeah,
great. Then
yeah.
that's fine, I believe. But the visa is easy and the exams are just two. So why is it so difficult to get the information and why are there so less Indians going to become a doctor? What is
That's
the
a
issue?
very, yeah, that's a very good question. Because like when you take when you look into the healthcare system there in Canada, it's full and fully public funded. So we don't have any private sectors. It's only the government who has hold of
Mm-hmm.
the healthcare system.
Mm-hmm.
And so the government pays the doctors as well. No doctors are paid by any private sectors there. All the doctors are
Oh,
paid by government.
all right.
So they have these budgeting issues and they don't want to like create more spots, and because they have to train the doctors as well, right? Even they
Right.
have to pay the residents and everything. It's all about budget. And
Okay.
they also think they don't have that much need as well, because
Mm-hmm.
right now we have a lot of immigrants coming in, but for the population they think for now it's sufficient, and even if they need any specialist or anyone, they are willing to hire instead of like creating a
Bring someone.
spot. And yeah, creating a spot, training them and spending money on them. They think it's easier. If they want someone from any subspecialty, they can just hire from US or UK. So yeah.
Okay. So, going deep into the whole Canadian journey, let's talk
Hmm.
about before going to Canada. I have some few questions.
Definitely, yeah.
What about the students who wants to directly go to Canada from their respective country where they are currently studying in right now? For example, somebody studying in Ukraine or Philippines or Russia. Can they directly apply from there to Canada or do?
I think it might be a little difficult when you apply as a student or when
Okay.
you apply immediately from when you're outside the country.
I
So
think we
yeah,
got a call.
if you already have someone, yeah, sorry about that. So if you already have someone living in Canada, like say your parents are there, you already have a PR, then it's easier for you.
Mm-hmm.
But moving as a student, again, you might have to. You can try calculating your points online because
Right,
even before you apply for a Canadian PR,
right,
there is an online calculator wherein it's an official calculator as well, wherein you can go give your medical degree and all the other extra details and see if you can fulfill the points. And
right.
if you can fulfill the points, you can very well apply for like PR and come to Canada. If not, then
Okay,
it might be a little challenging for you.
it might be a little challenging.
Yeah,
All
yeah.
right. And what about the IELTS, the English exam, proficiency exam? Is
So
it a
IELTS,
requirement?
yeah, it's required both for if you are applying for a PR, you will need a IELTS as well because it boosts your score points.
All
And
right,
also when you apply for CAMS, like the residency process, IELTS is
right.
mandatory. Either you have to
Okay.
do IELTS or TOEFLs, but I would suggest going for IELTS because a lot of many universities don't consider TOEFL. So it's better
Mm-hmm.
if you do your IELTS, then you'll be able to apply for a wide variety of programs.
Okay, so and what about the expenses before actually going through the exam? What is the expense before all of that, like the visa and moving there for PR? So IELTS exam. So like in total, could you give a general view? I mean, general expense.
So I would say you would have to at least invest like around $10,000 just to like migrate and start with your process and do your exams and stuff. Because everything is money, right? Like if you do an application, you
Right.
have to pay. It starts from PR. I think PR it's somewhere around $2,000. I'm not sure. You have to check the current
Right,
like
of course.
application fee online. But
Right,
definitely you would for just the process, like for all the examinations and
right.
everything, you would need around like $10,000 Canadian dollars.
10,000
And then
Canadian dollars.
yeah, and then if you're going to stay there, if you're moving to Canada and if you're going to stay there, if you're a bachelor, then you can very well survive with like $1,000 per month.
Okay.
And again, it depends because if you're having someone who can support you financially, then you can just sit at home and like study, give your exams. But if you
Right.
want to like support yourself, then you have to go to work and like,
Yeah.
yeah, do part-time jobs and stuff.
Right, we'll talk about this a little later.
Sure.
What about people from like who have given already PLAB or AMC they have given like other country exams. So which country
Mhm.
exams are like valid there?
No other country exams are valid there. You
Not
have
even
to go through.
USA.
No, no.
Oh,
You can give your US course when you apply for the residency here,
okay.
but it's you need your Canadian scores as well. Only if you have your Canadian exams, you'll be able to apply for residency here. They don't consider the exams, but if you do your residency in say US or UK, that you can come here with the residency program, but not with the exams.
All right. So that will be another program that you talked about earlier
No,
and
that's
not through
that's a
COMS.
different no, that's a different process. If you finish your residency program either in
Right.
US or UK, then
Okay.
you can directly register. You can apply for a license with the Royal College of Physicians and Surgeons in Canada, and then you'll have an exam related to your specialty. And
Right.
I think you'll be able to get in. You don't have to go through the residency process again if you do your residencies in either countries.
And what if somebody wants to go to USA? Can they go from Canada? Like after they give their Canadian exams, will they be eligible in the
It's the
US
same.
system?
No, it's this. No, with
It's
the
the same.
exams you won't. It's the same. If you do your if you do your residency here, maybe you'll be able to. I'm not sure about that, but maybe if you do your residency here, you can maybe work in US. But I don't think with the exams you won't be able to do anything.
All right. And what
Yeah.
about the gap year students? For the students who have already like given their PG exam in India and are
Hmm.
now, so that is another process for them because they'll be like independently working, right?
Yes,
Like you
that's right.
said
Yeah.
before. So, what if they have a gap year? Does it cause a problem in the future?
So as far as there is a gap of 3 years or less, it's not
Okay.
a big issue because even when you apply for your residency, they ask you about your recency. Either you have to be a recent graduate or you
Mm-hmm.
have to have clinical experience recently, like you have to be working in a setting as an independent practitioner. So if you have if it's less than 3 years, it's not an issue.
Okay.
And but the only thing is when you apply for your residency and when you go for interviews, they'll ask you, okay, if you have a gap, then they'll definitely ask you, okay, what were you doing? And you should have a valid answer for that, saying, okay, I did this, I did that. And even when you apply for your residency, you might have to explain if you have any prominent gaps in your CV, then you might have to explain it on your application as well.
All right.
Yeah.
And what should a Indian student do
Mhm.
to have an edge over other people when they decide to move to Canada?
So when you apply for a residency in Canada, we don't have a straightforward answer saying, okay, these are the criterias to get matched
Right,
into a program because
right.
it's really hard. Like I have gone to consultancies there in Canada. I have spoke to a lot of
Right,
people and everyone says, okay, it's a process, but we don't know exactly what we need to get matched in the process, right?
right.
What I would suggest is whatever you do, do your best and try to have the best results. Like even if you go for your exams, try to score well, have high scores. And they say they don't have like a cutoff point or for the scores. But
Okay.
when a lot of people apply, it really no one has to say that, right? If you have good scores, then your application will be
Yeah,
considered.
right.
And then they also look into your clinical experience and when was your last clinical experience and if you have any research backgrounds or any publications, that's an added asset.
All right.
And yeah, things like that. But you don't have a straightforward criteria for getting matched into a residency. But I would say whatever you do, try to do your best and yeah.
Okay, so were you able to like look into the faults that you had because you were not matched? Because I'm sure that you had a great score in your exams. So
Mm-hmm.
were these requirements not fulfilled, or and other students had like few publications and few clinical experience above you, or how was it?
Maybe I'm not sure because when I think about my application, I personally feel because I had a different exam. I had an additional exam before, which was known as evaluation exam. It's known
Okay.
as mccqe. It's faded out now. From 2020, they don't have the exam anymore.
Oh,
But
all
people
right.
who started the process before, they know about this exam.
Okay.
So that's why I said whatever you do, like try to do your best. Because when I went there, I was in a rush. I wanted to like get into the process, finish all the exams, and apply for a residency. And since no one was there to guide me, I was like, okay, I'm just going to study. I'm going to go give the exams. I want to finish everything fast, fast, fast. But then in evaluation, I was not able to score a really like high score.
Mm-hmm.
And I don't know if that was an issue, but when I
All
spoke to a
right.
lot of people, they said it's not a big deal because when I did OSCE, I really scored well. So they said if you
Okay.
have a good score in OSCE, then that shouldn't be a problem. But we don't know what they look into, right? And
Right, of course.
also, since years passed, I was out of practice as well. I
Mm-hmm.
applied to the residency when I was in 2 years after going to Canada. And
Okay.
then once I didn't match in my first match, then years went by and I was also coming out of practice as well, right? So then I
Right.
had to come back to India and I came back to India and updated my clinical practice for a couple of
Oh,
months.
all right.
Yeah. Yeah, so but it's a really competitive process, which is very understandable. A lot of applicants apply every year, and very minor amount of people get matched. So yeah,
All right.
yeah,
So it's difficult for IMGs to
definitely,
get
yeah,
get into
def
Canada. And
definitely.
like you said that you came back to India for your to update your clinical experience. Were you
Mm-hmm.
not able to score any like clinical experience in Canada itself? Did you had the
So since
chance?
I don't have a license there, right? Because they
Right.
clinical experience, if you do observership, if you work somewhere as a part-time or even full-time, if you work as an assistant for someone, it's not considered as a clinical experience. They ask you if you have independently practiced medicine. So for that, India is the only place where I had license because I finished my graduation here,
Okay.
and so I came back and I like worked here for a couple of months and then went back.
All right. I think we have
Yeah.
covered almost all the questions before
Mm-hmm.
going into the whole Canadian exam and the process.
Mm-hmm.
Let's begin. Canada. So now that you went to Canada, when
Mm-hmm.
did you apply for your Canadian exam? What was the procedure and what were the requirements? What was the fee structure? Your
Sure.
preparation time, sources, everything.
Okay. So once you start the process, it would at least minimum take 2 years for you to apply for a residency program.
Okay.
This 2 years, you'll have to do all your document verifications, get all documents gathered, and then apply for exams. So I did mention about Physicians Apply, right? It's an online portal where you can get your documents verified. It actually takes a long time because we have to send a photocopy of our documents to the Canadian office, and
Mhm.
then they mail it back to your college. If you studied in India, they send it to India. If you are in Ukraine, they send it there, and then the college has to verify it, saying that okay, this student studied here, and then they send it back to Canada. It takes a long time. So what I would suggest that if you are planning to move to Canada, try to finish all these process when even before you move there.
All
So it
right.
saves a lot of time. Even if you want to go and speak with your like college personals, you can do it when you are here in India. Because once I left there, it was hard for me. I had to contact my mom, asking her, okay, go check, go do that.
Okay.
So
Okay.
it's a difficult process. And when we are talking about documents, I already mentioned about the medical transcript and MSPR, right? Even those two documents, try to do it when you are in the like when you're studying or when you're about to finish your college. Try to get those documents as well if you're planning to move up abroad, because
Right.
maybe Ukraine universities give it, but Indian colleges don't have that. So we have to find a format, and then we have to do the document ourselves, and then we have to get it signed from our dean.
Okay. Okay.
Yeah, so this is a huge process, and it's easy
Huge.
when you are in person.
Right.
And try to get all those done even like before you finish your graduation, and like if you are planning to go to Canada.
Right.
And so once you are done with all your document verification, and then you'll be able to apply for your exams. So right now, the first exam is all the examination is controlled by Medical Council of Canada. So you'll be applying
Okay.
to them. And the first
Okay.
exam is qualifying part one.
Right.
So I think the application fee at present it's somewhere around $1,400 for the exam.
Okay.
And it
Canadian
keeps,
dollars.
yeah, Canadian dollars. It keeps dating constantly, so you can check on their website.
Right, of course.
Yeah, and once you have the eligibility from Physician Supply, you can apply for exams. You don't have anything extra. You can just apply for the exams. And the exams usually take place around 5 to 6 times a year. So you have to
Okay.
plan well ahead and see when you can get the dates and when you have to apply for the exam. So you can just go through all those on the websites.
Okay. Which
Yeah.
website are you talking about? The physician's portal
MCC
only?
Physicians Portal is used to apply for the exams, but you can go and check all the details on mcc.ca. It's Medical
Okay.
Council of Canada website.
Okay. For the documents also, because some student asks about the format of the documents and the number of documents required.
So for the documents, you can go and check in Physicians Apply.
Okay. Any
Yeah.
specific or any important document that you would like to mention right now?
I would say only the transcript and MSPR, you have to keep an eye
All
on that
right.
because all the other
Right.
documents we have it. So these
Okay.
two are the main documents which we have to like just be sure we can get it done when we are in India or wherever you are.
Right, right.
Yeah.
So, about the exam, how
hmm
difficult is it? What is the format of the exam? For the part one, right now I'm
So
asking.
for part one, it's a 1 day exam and it's around like
Mm-hmm.
8 hours. It comes in two parts. The morning session, it will be around like 3.5 hours, and you will do a MCQ part in that. It's an online exam. You have to go to the center,
Mm-hmm.
and I don't know right now. Maybe they have virtual exams, but it
Yeah.
used to be that way. Like you have to
Okay.
go to the center. It will be the first 3.5 hours. It will be an MCQ part,
Mm-hmm.
and you will just do all the questions, and then once that's done you have a lunch break, and then in the afternoon uh, the second part is a little different when compared to other exams we give. It's called
Okay.
as clinical decision making. It's CDM. It's called as clinical
Okay.
decision making part,
Okay.
wherein you'll be having questions, and then you will either have to choose or type in terms of like investigations. They'll give you a case and you have to find the case, and then they'll say, okay, manage this case. You have to like manage, investigate, or whatever they ask for.
Right.
So
Okay.
that's, yeah. So I would say exams are a little different when compared to exams which we take in India.
Right.
So you have to have a different approach when you study for these exams.
Mm-hmm. Okay.
Yeah.
And what about the source or the material for preparation for the MCQ part and any um, tu tuitions that you took, any coaching centers that you went for
Right.
your clinical, the second part, the CDM?
Okay, so for part one, it's all theory, right? We just have to study on ourselves. Or they do
Okay.
have coaching centers for that too, but I didn't go for
Right.
any at that time.
Right.
So try to get study partners. That's very important when you study for exams like these competitive exams, because when we study in college, we have a motivation, right? Because we go to
Right.
class, we have something, we have notes, and then we
Uh-huh.
have a motivation and we just study and go for the exams. But when
Right.
we study for exams like these, we need someone who can like push each other. So try to get a study partner, or even if you have a group, that's well and good. You can have a study group, and then like for part one, Toronto Notes is the main, like it's the Bible for um, the exam.
All right. Toronto
Yeah,
notes.
Toronto Notes, yeah.
All right.
So they keep updating it every year. So get the recent one, most recent one, and
Okay.
it comes in PDF too. I don't know if the books are available in India, but you
Uh-huh.
can like check online for their PDF, and then you can purchase it and you can start studying from there. It's like a notes.
Okay.
It's a summary of all the things needed for the examination. It's like a notes.
All
So you
right.
just have to go through each and every page from
Mm-hmm.
that, and then we actually don't have any proper question banks right now. The
Okay.
only question bank available is the Canada Q Bank.
Okay.
Yeah, so you can like take a subscription there and try. You can practice doing questions there. So you can do that. And
All
on
right.
top of that, I would suggest try reading US materials as well, like USMLE books
Okay.
for step 2 CK, and step 3 you can use it for part 1.
So, step two CK and step three,
Step 3,
books
step 3
books
can be
can be used
materials
for
used for
mat
part 1 exam.
part one exam.
Yeah, you
So it
don't
is
need the
that
step 1.
difficult.
You don't need step 1 because step 1 is all about basic science. Usually
Right.
Canada doesn't worry about basic science. It's more about the clinical part which they concentrate on.
Okay.
So because there are not a lot of resources available for Canadian exams, so a lot of
Mhm.
students try to use the US material as well because it's all medicine, right? So
Right.
like they try and solve questions from there. So yeah, you can use step 2 CK and also step 3 books.
So, like you mentioned about the study partners, are there
Mhm.
any groups on like Facebook, for example, or Telegram, which you can
There
find
are a
and
lot of, yeah, there are a lot of groups on Facebook, and I don't exactly know about Telegram, but once you are able to connect with someone on Facebook, and also there is a forum called RXPG Online, right? I think most of the medical students would be aware of who are planning to go abroad.
hmm.
They might know this forum. It's called RXPG Online,
Okay.
and you will find people from all over the world there. Like whichever country you want to go, you can like connect with those people, and then you can chat with them, and there are a lot of topics there. You can even go and choose which exam you want to like
Mhm.
which forum you want to join, and then you can find contacts there.
All right. So I think
Yeah,
that will also help understand the Canadian medical system more better
definitely,
and
definitely, yeah.
yeah. What about like between the exams? Like you told us that you should, if somebody is not financially capable, so they can do other work also, side work. So are there actually any opportunities in medical field, for example, like observing in the clinics or something like that?
You can very well do observations, but observations usually don't pay the students. Like if you
Right.
go and observe, they don't pay you. It's just like more
Okay.
like a
Yes.
volunteering, right?
Right.
So
Right. Right.
before hospitals used to give observerships for IMGs, but they don't do it anymore. And right now
Oh.
it's more like you have to go and contact the individual physicians and ask them if you can come and observe them in the clinic. And most of them are very friendly. They'll be like, okay, like you can come like twice a week, just come and observe. But if you
Okay.
want to get paid, then there are a lot of jobs for getting paid as well. Like you can work in medical offices, a medical office assistant, or you can work in administration side, and there are a lot of a coordinator program kind of jobs. And
Okay.
or even you don't have to do any course. You can go and join as a research assistant as well, because a lot of research work has a lot of clerical job as well, right? So if you go
Right.
and join as a research assistant, or say that you can work as well. But the thing is,
All right.
when you work part time in medical field, the pay is not that great. Like you have to
Mm-hmm.
be ready for that. If you are expecting to work in medical field, then it's probably the basic pay. They'll just give you like $14 an hour, and depending upon the role. So it will be
Right.
very, yeah, very minimal.
And how many months does it like require for us to prepare for the part one exam?
Part one, I would say minimum 6 months. If you
Okay.
can give us a time of 6 months, then, and some even take a year, so it depends.
Okay.
Like,
Okay.
yeah, but I would
So,
say minimum 6 months.
like, how would you grade like 1 to 10? Like, how difficult is the exam? Is it doable for IMG?
Exam is definitely doable. Exam is definitely doable. It's just that when I went to the exam, when I came out and when people asked me how was the exam, I didn't know what to say, because I kind of felt it was so vague. Because how the questions they structure is like they ask you a question, and they, if it's an MCQ, you have five options,
Right.
and you would think that two are best options for the question, and you don't know which one to pick, and once you pick, you don't know if it's the right if it's the right answer or the wrong one, right? So I kind of felt it was a vague exam. But yeah, maybe with practice you'll be fine if you practice more and more
And
questions.
right. And what about part two? Well, everything, if you can tell us the preparation
Sure.
sources and
Part
time.
two, part two is not taken by everyone. It's the other exam, the NAC OSCE, which I told you earlier.
Mm-hmm.
Qualifying exam also has part two, but we'll talk about it later. Before that, NAC
Okay.
OSCE is required to apply residency there. So it's
Okay.
a clinical exam. It's like it's a OSCE exam, and they have clinical stations. Say if you have 10 stations, they have cases in each room, and you will
Right.
have to rotate. Like they give you probably, I think, 8 minutes. I don't remember exactly. I think 8 minutes
All
or 10
right.
minutes for each case. And then you will like kind of rotate, and there is an examiner in the room. It's all simulated patients. We don't have real patients like we have in India. So
Right.
it's all actors. They'll like tell you their complaints, and you'll have to like collect history, do a physical examination, and at the end of the station, they ask you a question, and then you have to answer, and then you keep
Mm-hmm.
rotating. So that's the clinical exam.
So is it like easier than part one?
Uh, Personally, for me, I felt it much more easier,
Okay.
because if you have a good communication skill, you can manage the exam. Like, because everyone has the basic clinical knowledge, right? You'll have a basic
Right.
clinical knowledge if you study medicine. So you don't
Right.
have to go into depth for the OSCE as when
Okay.
compared to MCQ exams. So if you have
Um.
a good communication skills, and if you are good with your checklist, like if you take a system like RS, if you know what all questions you have to ask a patient, if you don't miss out any red flags, then it's a cakewalk for you.
Wow. All right. And what
Yeah.
about the materials that you use? I mean, anything on the internet or
So for OSCE, I would suggest going for some crash course at least because I went.
okay.
They have courses in Toronto. I used to live in Toronto.
All
So
right.
even if you are in Canada, like there are a lot of places where they offer these courses, like where you can go in person. It's a good experience. Like we don't have any other school experiences there, right? So if you go for a
Right.
class, yeah, it's expensive. I would say you would have to pay around like $2,000 to $3,000, but it would be worth it. Like you can go meet other IMG students there. A lot of people will come there. It's more like a
Mhm.
classroom, and you have a teacher. They tell you about the exams, and they make us perform as well. Like you will perform with other partners. You'll just let go of all your fears when it comes to like talking with the patients and stuff, right? Because as a
All
fresh
right.
graduate, it might be
Right.
challenging for you that way.
Right. Right.
So it's better
And
you take some course.
what about the duration of the crash course and how long does it take?
So for me, I think I went for around 12 classes, maybe 12
Okay.
to 15 classes. You can pick and choose the package with whatever kind of classes you want to attend. You can even go for a weekend 3-day course, or if you want to do elaborate course, I think I went for 2 months, probably 12 classes.
Mhm. Okay, and
Yeah.
how many, like, what about the months of preparation that was required for you to pass the OSCE?
So if you go for a class and if you think you are okay, they'll also let you know like how you perform, and they have a mock test and you can give that,
Okay,
and they give you all feedbacks. And
okay,
even they say you are ready for the exam too. So if they say that you are ready for the exam, then you can like go ahead and take the exam.
okay,
But
okay.
the only thing again here is the exam happens only twice a year. So you have to
Oh,
be
all
prepared
right.
according. Yeah, you cannot like it doesn't happen every day. So you cannot be like, okay, I'll just prepare and then I'll apply whenever no, you have to apply for
Right.
your exam and then plan accordingly. So once you fix your exam date, try to take the course like 3 to 4 months before, I would
Mm-hmm.
say, and
Mm-hmm.
then you'll get an idea. Like once you go to the course, you know how you are performing, and then you'll make a lot of friends there as well. So even if the course is done, you'll be in
Mm-hmm.
touch with these people, and then you can keep practicing with. You don't need a patient. You will know once you go to the course, and then if you have friends, you can practice the cases with them, and you'll be in touch. You'll be fine. I would say
Okay,
three to
wow.
four months of preparation.
And like, is there any validity of the test results? For example, you passed the part one and then you have like had a 2 year gap before
I
giving the
don't
NAT.
think
Okay.
so. As far as I have seen, I don't think so. There is no expiry for the results. And
Okay.
also, I don't think maybe, no, I don't think so.
All right. Okay.
Yeah.
So, and what about the whole expense of this second part two? I mean, OSCE exam.
OSCE exams are expensive compared to the theory
Okay.
exams because they
All
have
right.
to arrange like actors for us and they have to
Mm-hmm.
hire like people, right? So I
Right.
think it's 2,500 Canadian dollars. You have to probably check the current price. Somewhere
Okay.
around
So,
that,
wow.
like 2,000 to $2,500 maybe.
And like you said before, that it takes like 2 years to match into the program. So the
2 years to
whole
minimum apply for residency. It's not apply apply for
yes, 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 to
yeah.
apply for residency. So
Hmm.
once you match, then like what is the general year requirement to become a specialist or a consultant in Canada in general? I would like to
General
ask you.
for family medicine, it's 2 years residency training.
Okay,
And for specialties like internal medicine, pediatrics, and obs and gynae, it's 4 years.
okay. And what
So
about anesthesia, dermatology, and
those comes with 5 years, I guess. Five
all
years. And
right. So
if you are planning to like do some subspecialty, then you have to like extend your post graduation year of training.
okay, so I think like in your experience, how is
Mhm.
the work culture and the people there and the lifestyle in Canada?
I love Canada to be honest, because a lot of people kept asking me, okay, you're not able to get into Canada. Why do you keep like pursuing it? Why do you keep trying for the same? You can
Right.
go opt for other countries, right? I personally love Canada because like when I talk to other like my friends in other countries, work culture is pretty much the same in US, Canada, and UK.
Mm-hmm.
But as a country, I like Canada very much because people are really polite there, and there is no racism. I think even a lot of people ask me whenever I say, okay, I am trying to get into medicine in Canada. They're like, okay, do you face any racism? No, never, never. We have never came across
Wow.
any scenarios like that. So yeah, and especially when compared to Indian work culture, it's much more relaxed there, and you get a good training too. So yeah.
Right. So I think we covered everything about the exam, the whole pattern, the amount, the expense, the duration.
Mm-hmm.
I would like to ask you, like, if somebody is unable to match, what
Mm-hmm.
are the other options for the person? Like, can they still try again? How
You
many
can
number of
try
tries?
every year. Yeah, you there are no like there is no limit for the number of times you try. So
Right.
the match happens once every year, and all this application process and everything. This cycle happens from November to March or April. So you have like every year you have a chance to like, apply for residency, and
Right.
you can keep trying, but like a lot of my IMG friends who were not able to
Mm-hmm.
match, they also went into alternative careers as well.
Okay.
So
Before we go into
mhm,
that, I would like
mhm.
to ask you, after the OSCE exam, is there any
Mhm.
other exam that we have to give or just wait for the match?
You will have to do the English test, the IELTS.
So after OSCE, we have to give the IELTS exam.
Whenever you can give your IELTS whenever you want, but I would say if you are applying for a residency program, try to give your IELTS like 6 months before you start your application process, because IELTS has
Right.
only 2 years validity, right? Even if you don't
Right.
match in this process, then you can have the same IELTS for your next match as well.
All
So
right.
yeah, you don't need IELTS to sit for the exams.
Mm-hmm.
So if you have time, you can take it later.
And so, like after IELTS, also these three exams, then we
Mhm.
have to wait for the match day. That's
So
all.
we no we its
Okay.
application itself is a long process. Exams are easier when compared to working for applications, I would say, because so once you are done with all your exams, you have your degrees verified, then you have to go and open an account in another portal called CARMS, which is the one
Okay.
I mentioned before,
Yes.
the Canadian
Yes.
Residency Matching Service.
Yes.
So you have to apply through CARMS. It's an online portal. You will be submitting all your like documents again there. And so it's not like Indian system. Here in India, if you want to go into a postgrad residency is similar to post-graduation in India.
Right.
So if you want to go into a post-graduation here, you just take a common entrance exam like NEET, and then you'll be given ranking, and then you go to a
Right.
counseling and you match. But in
Right.
Canada, it's totally different. You do all
Oh.
your like you gather all your documents, and they have different universities. So each university gives a certain number of seats for different specialities.
Right.
For example, let's say Toronto is a famous city. We have University of Toronto, and if University of Toronto is giving, say, 20 seats for family medicine, you will have to apply separately for each university and each program.
Okay.
So if you're planning to apply family medicine throughout Canada, then you have to go and apply for each university separately. Like I have to apply to
Okay.
Toronto separately, whatever universities are there. Like I have to apply separately. So
And
for
what about like if we are applying to different universities, do we have to pay each time or is it
yes,
the
yes. So
oh,
on Carms, it's but they have a fee every year. Like when you
mm-hmm.
are planning to apply for the residency this year, then you have to, I think it's around $300. I don't know the exact amount. It's somewhere around $300. And once you pay that, you'll be able to pick nine programs with along with the
All
fee.
right.
So on top,
Okay.
if you're planning to apply for extra programs, then for each program you are planning to apply, you have to pay $30 extra for the application
Okay.
fee. So that
Okay.
itself is a huge expense on its own. You have to
Right.
be ready for that. For each cycle, you might, if you are planning to apply for a wide variety of programs, but then for each cycle, I would say you will spend around like $1,000 minimum,
Wow.
thousand
So
Canadian dollars.
by program you mean subjects, right? Like
Subjects, yes,
courses.
specialities, yes,
Right.
that's right, that's right.
Right.
And on top of all these, when you apply, when you get ready with your application, there are other things you have to look into. As I said, you will need your PR, permanent residency, or
Right.
Canadian citizenship, and then you need
Right.
your IELTS, and then you need your
Right.
exam scores, and then you need your documents. That those things you already have. You will have it verified from Physician Supply, right? So they will
Right.
ask for your documents, and then what else? They ask for your CV. So you have
Right.
to get your CV ready, and then on top of that, they have an important document known as personal statement or personal
Mm-hmm.
letter,
Mm-hmm.
wherein for each program they will ask you for a personal statement where you have to tell them why you like this specialty and why you want to go into this university. It's more like a personal letter. You have to
Right.
refer to the program director and you have to write a letter and then you have to submit those things. So it's a big process on the whole.
Okay. Wow.
Yeah.
Yeah, this
Yeah.
is like really insightful and very new to understand. Like
Yes.
every step have we have to pay.
Oh yeah, definitely.
So so
I think
like
US is similar to US. If you are planning to do
yes.
your USMLE and if you are planning to go match there as well as the process kind of similar.
Right, right, right.
Yeah.
And what, like, after you have given out all the personal letters and everything after this, then you wait for the match, then you wait for the university to call you, and
So then we wait for the university to call us for an interview. And if
okay,
once you submit your applications, the programs go through your application, and if they think you are an ideal candidate, they give out interviews, and there is an interview period which happens for around 3 weeks. And if you are
hmm,
selected from multiple programs, you'll get multiple offers, and then you will have to travel and go to each university and do your interviews. And once you are done with the interview, then you'll be ranking the programs you applied for, saying that okay, this is my first interest, this is my second interest, I want to go here. So you make a list,
okay,
and then the
wow,
programs make a list as well. Once you are done with the
right,
interview, the programs themselves, they make a list as well. Okay, I like this candidate, for example, number one Kushbu, number two Kavya, so they make a list,
hmm,
and then
right,
if both matches, then you match.
all right. And
Yeah.
so what, like you mentioned that we have to also submit our CV. So did you do
Yes.
anything in that period to enhance your CV?
So once you're done with the exams, even if you are doing your exams, I would say try to do something. Like even if you are in Canada, if you're in India, well and good, or wherever you have your license, try to work when you are here. Even if you're preparing for exams, try to work on the side and keep your like CV updated because that's an important thing which I didn't know. I was like, okay, I will go
Okay,
study, do my exams, and for the
right,
period when I was studying, I didn't do anything. I didn't know.
right,
So I did a couple of observerships, but observerships are just an add-on. It's not like a big deal, right? Like anyone can go and
right,
observe. So
right,
try doing voluntary, even if you're in Canada, try going for some volunteering experience. It doesn't matter what kind of volunteering you do. Like go for
right,
volunteering. If you're able to like work for some research projects, work there. Even if you don't get paid like work, at least you will be able to like have something on your CV. So
right.
try something like or work in healthcare too, and something to talk about when you go to interviews, and something to put on your CV as well.
And what about volunteer work that you do in India, like for example, teaching someone? Does that
You
count?
can put anything and everything. Whatever
Right.
you do, just put it on your CV. Yeah, put it on your CV.
Okay.
And like when I went to a couple of when we do our CVs initially, we need help as well. So there are people
Right.
who help you with your CV and stuff. Just go through
Okay.
and correct your CVs. And
Wow.
also, when I'm talking about the CV, I would like to tell you guys about an organization called Health Force Ontario.
Okay.
Health Force Ontario. I'll give you the link for that as well.
Right.
So this organization is government funded. So it's a NGO process. So they don't ask you to pay or anything, but they
Okay.
help all the internationally trained physicians, or even not only physicians, they all other healthcare professionals as well. So if you have any doubts, they walk you through the process. Like they help you in each step. If you have any doubts, you can talk to your advisor there. They help
Oh,
you,
okay.
and yeah, so it's a very good resource which you can use.
All right, that is a
Yeah.
great. So this healthcare forces in Toronto, like, are they on Facebook, or where do you
They
find
have a
them?
separate website. You can go and register with them
Okay,
online. Yeah, I can send you those links. You can have a
all
look.
right. Yes, of course.
Yeah,
Please do send
yeah.
me the link after the live
Definitely,
for all of these,
definitely, yeah. So
and
that's
we'll put
when
it
they
on it.
said on CV, like what they usually say is like when Indian students go in for CV correction, what they say is you guys are so humble and you don't try to boost what you do. Even if we do things, we don't try to like, okay, I did this, I did that. We don't
Right,
boost anything on our CV. That's
right,
one important thing they say that whatever you do, try to put it on
right,
your CV. Say, okay, I did this, I did that. Only then
right.
people know about it. Yeah.
And so after all the huge process and everything, so once you wait for the match, and if
Mm-hmm.
you're matched, you get into residency. And like you said,
Yes.
it can be like 2 years for family medicine, and other
Mm-hmm.
specialty can be 4 years and 5 years respectively.
Mm-hmm.
How comfortable is the salary for the doctors there? I mean, for the
So
PGA.
for post graduation, the salary usually starts from 60,000 Canadian dollars per year
Mm-hmm.
when you start a residency program, and it keeps increasing with the number of years you keep training with them. And also,
Okay.
it depends upon the specialty as well. If you do family
Right.
medicine, you'll get a basic pay, and if you are going into some specialties like surgery or something, then you get paid higher. And on top, you also get paid for go having on calls and all those things.
Okay, so is the 60,000 the basic salary, or
Yes, yeah.
so
It
is
starts
it
from somewhere $60,000. Yeah.
right? So I mean, is it enough to live a comfortable life in Canada?
As a student, I think it should be more than enough for you. Like when you do a residency, that money should be good. You'll be able to get around like $3,000 a month, 3,000 to
Right.
$4,000 a month. So you should be okay.
Okay, so what is the like general expenditure of like for personally, as in?
Housing is the main housing is the most important thing because that rentals are really expensive depending upon the city where you are in Canada. Rentals are like expensive if you're in Toronto, but if you're in outer somewhere, like if you're in suburbs or in a
Right.
different city, rentals are cheaper there, so you don't have to worry about all those things. But the most main expenses would be your like housing, car, and because most of the programs would like you to have a car because you will drive around for like rotations and stuff.
Right. Right.
So yeah, those would be your expenses and food.
Right. So the people who have matched, so they'll get into residency and they'll earn
Hmm.
this. What about the people who were unable to match? What are the options for them? Different
Uh,
countries, try again, go back to home country.
I would say if you are very particular about Canada, try again for a match or two. But try
Okay.
working on option plan Bs as well. Like try other countries. If you are in Canada and if you want to go try in US, try starting your process with USMLE. Or if you want to go to UK, look into that. And try to keep your practice updated as well. Wherever you have your license, try to keep your practice updated. Don't go like more than 3 years without out of practice. So keep all
Right.
those things in mind. And even if you're planning to move from India, like if you're working here already as a doctor, what I would suggest is don't go to Canada, like quitting your job until you finish your initial process, like you do your document. Even you can do your QE part one as well here. So do everything because you'll be in touch with medicine as well, right? You will not have
Right.
much gaps too.
Right.
So just don't leave everything and go there and like sit and waste time. Instead, try to be connected with medicine when if you can practice.
Okay.
Stay here, do all the basic works, and then once you are done with your first exam, then you can like migrate and go there.
Okay. And what about
Yeah.
other countries? Like we have given the licensing exam of Canada and we
Hmm.
have good scores. So is this valid in other countries like UK or Australia or not?
Exams doesn't help in any way. I don't think so. But right now in UK, the process has changed, and they are considering Medical Council of Canada exams. And
Okay.
if you have scores from there, you'll be able to apply for UK. And I think, but you will need qualifying part two as well. We didn't talk about qualifying part two.
Yes.
So qualifying part two is not necessary to apply for residency in Canada.
Right.
But once you are into the residency program, you have to do your qualifying part two before you get your license. Only if you are done with your part two, you'll be able to get a medical license there. So this
All
is
right.
again a OSCE exam. It's similar to the NAC OSCE exam, but more elaborate. Like you'll have emergency medicine management cases in part two. Many
Right.
are not able to take this exam beforehand because it requires 1 year of postgraduate training to apply for the exam.
Okay.
So eligibility, that's one of the eligibility to apply for qualifying
Right.
part two. And a lot of Indian medical graduates have the eligibility because we do 1 year of internship. So I was able to take the exam. But many foreign graduates who graduate from other countries, they are not able to do it if they don't have internship. So you either
Oh,
have to
okay.
have a postgraduate training 1 year to apply for the exam.
Oh, all right. So we have
Yeah.
to have the training and then we can apply for that.
Yes. Yeah.
And so for to apply to other countries, then do we have to have part one and part two plus OSCE, NAC OSCE exam?
I don't think they ask for knack. As
Okay.
far as I remember, when I checked through their process, it said
Right.
if you have your part one and part two and your English test, then you'll be able to apply for it.
Okay, wow. I think
Mm-hmm.
we have covered like almost all the questions.
Okay.
Uh, if somebody has any questions that we have left out, please mention here and with us. Is there anything that you want to add, Dr. Kavya?
Sure, I'm also thinking if I just left something. I didn't tell you about return of service. Like when you do a residency program,
Okay,
once you are done with your training, you will have a return of service bond as well for some programs. Like most programs, I wouldn't say some programs, most programs
okay,
have this bond wherein it's
okay.
like a rural service which we do in India. Once you,
Mm-hmm.
there are bonds for post
Right,
graduation
right,
sometimes, right?
right.
It's similar to that. Like you will have to sign a bond and work in return in some suburbs before you can move to your place of choice.
Mm-hmm.
So, yeah. You can
So
find all
I
those informations on CARM's website. I'll give you the link.
Right. So cost of Canadian exam, ma'am has already told it's 1,000 for part one and OSCE is 2,500 Canadian dollars. So you can add up. And
Yeah.
later on, then we have the part two of the exam. So how much does that cost?
I think it's
The
similar to
exam.
Nakoski as well, somewhere around
Oh,
2000,
okay.
2000. Yeah.
So what is your final conclusion? Should somebody try for Canada? Because it takes so many years and huge
It,
amount of
yeah,
dollars.
yeah,
So,
it definitely. So whenever people ask me, what I say is, if you like Canada, if you what you have to think what's your primary goal, right? If your primary goal is to like practice medicine in your specialty of interest, or if you don't want to waste your like number of years, then I would say don't pick Canada because it's definitely a long and competitive process.
right.
But if you are already there, because a lot of students go outside, they have their parents there and they go outside and study and go back to Canada. They don't have options. They have to go through the process. So
Right.
if Canada is the only option you have, and if you want to, if you are very particular about the country, then do try because like definitely people are matching, right? So you
Right.
do have a chance. But don't get stuck. If you don't get matched, it's a very tedious process as well. And I have seen a lot of IMGs going through phases of like depression because it's a lot of mental stress too.
Right,
So
of course.
yeah, try to stay positive and keep trying. And if you're not able to get it, then it's okay. You have other opportunities. You can try other things and do other things. And yeah,
Right.
so
Once
it
you go
depends on
abroad,
what you
you
actually
have,
need. Yeah,
yeah, once you go abroad, you have like a lot of exposure and understand other countries as
definitely,
well. So
definitely,
I think,
definitely.
right. And like you mentioned earlier, so the total time frame, could you please tell us again? A lot of students are asking.
Yeah, the time frame usually it takes minimum 2 years for you to apply for a residency program. That's the first step. And so for to do all the exams, it takes minimum 2 years because with the preparation time and all getting the documents gathered and everything, you will also have to apply for your PR and get those things done. So for all these things, once you start your process and once you when you apply, it takes minimum 2 years for you.
All right. So after applying, then we wait for the match, and that can take
Yes,
like
that's right.
almost a year.
That doesn't take a year. Once you're done with all your application process, it usually happens in like 4 months. I'll say
Okay.
you'll start the process somewhere in the applications open in November. It closes in November. So once the
Right.
application closes, it takes around 3 to 4 months to get all the interviews and everything done, and the match happens in April.
Okay. And what about like the exams also? Is it included in the 2 year duration, the time
Yes,
frame?
yeah, yeah, yeah.
All right. And
Yeah.
somebody asked us exact pathway for document verification. I think you almost explained it very well, the exact pathway for document
Mm-hmm.
verification, like
Please
applying to
go
the
and check
portal.
physicians apply. Yeah, physicians apply,
Right.
and you'll be able to find all details there. But in terms of Canadian
Yeah.
process, one good thing is you'll be able to find all the information online, but you have to know where exactly to go and do.
Where?
So if I'm
Uh,
able to give you the links, then you
yes.
can find all the information there.
Can you actually tell us some more about the links? Like, can you speak it out?
Yeah, sure, I can say for documents, it's
Right.
physiciansapply.ca.
Right.
And then for all the examination purposes, you can go and see MCC, which is Medical Council of Canada,
Okay.
mcc.ca. And for the CARMS, the residency matching and all those application process, you can go to carms.ca, carms.ca.
All right. And
Yeah.
like you said that every person who wants to go to Canada,
Hmm.
in terms not only for family medicine but for to become a surgeon, I mean to get into residency as a surgeon and derma and anesthesia, etc. They all have to pass through the whole pathway that you
Yes,
explained.
yes, yeah, that's right. So if you want to
That's
go
it.
into any specialty, CARMS is the only way. Unless you get trained in countries like, say, UK, probably US, and like New Zealand or Australia, a few exceptions are there. Again, you have to go and check in the Royal College Physicians of
Mm-hmm.
Physicians portal to see what programs are approved by them. But I don't think most of our Indian training is not accepted there. So anyone who studies in India have to go through this process. And but I told you about another pathway too, right, in the beginning. If you're
Right.
not going into CAMS, you can also try practice ready assessment programs.
Okay.
uh, I'll just give you a brief about it because I too don't know much details about it. How
Right.
this works is like we have different states in India, right? There we have different provinces. States is referred in Canada as provinces.
Mm-hmm.
So if you want to work in a certain province, you can directly apply to their healthcare system,
Right.
and you can, if you have independent practice experience, then you can, it's the same documentation and examinations, but you can apply directly to them, and they will have a residency training program, which is a shorter training. It's like 6 months training, and then once it's done, you'll be able to practice, but you can only practice family medicine. You won't be able to do anything else.
Oh, all right. And
Yeah.
what about like, are there any branches that IMGs cannot apply to?
There is nothing like that, but you can see the seats allotted on the CAMS website for IMGs,
Okay.
because
Okay.
IMGs have a separate quota. You cannot apply for all the programs which is available.
Right.
And for example, last year in 2021, I think overall in Canada they had 3,500 residency spots, but
Okay.
among which only 350 seats were for IMGs. For
Oh, all
so
right.
yeah, so only 350 seats are allotted for IMGs, and majority of the seats go for family medicine. Say around 150 to 170 seats go for family medicine,
Right.
And the next popular one is internal medicine. You will have around like 50 to 60 seats for internal medicine, and then like 30 seats for psychiatry. And with specialties, it goes down. Like for pediatrics, you have around 15 to 17 seats. And for
Right.
obs and gynae, it's just four. And if you go for surgery, general surgery, one, anesthesia, one,
Wow.
derm, one, radio, one. And yeah, so it's
Very
really
less.
competitive.
Very, very competitive.
Really
And
competitive, yeah.
is I mean, the residency valid in India? Once somebody wants to come back to India for various reasons, can they practice
I
or do they have?
I am not sure about it because I haven't looked
Okay,
into the process yet. So I think
okay,
it's better they check with the regulatory bodies here. I
all
think it
right,
should
okay,
be. I think it should be.
okay,
Probably you might have to do an exam or something, but I think it should be.
all right. So we'll check it in the internet itself for that.
Definitely, definitely.
Right. So I think, Doctor, we have completed like all the questions. It was an amazing live session. We got such insightful knowledge and so new verification process and matching
Hmm.
process. It was really new to us. So I'm really thankful for your time. Is there anything that you would like to say to me or our page or to the students? That would be great.
Definitely. I was actually so happy when you guys contacted because a lot of people do ask me personally about the process in Canada, and it's hard to like say in a text message, right? Saying that, okay, this
Right,
is the process because it's a very big process. And that's the reason I made a video on our channel as well. But since
right,
it's a regional language channel, I did it in Tamil. But I do have
right.
plans of doing a video in English as well. But since you
Definitely.
asked, it's more easier to grasp when you it's a Q&A, right? Instead of like just
Right,
talking about the process.
right.
And also, you guys are doing a great job because it helps a lot of students.
Thank
Right
you.
now, like people want to travel, they want to work abroad, and it's hard to find information about each and everything. And what you guys
Right.
do is a very big help for medical students, I think.
Thank you, ma'am. Thank you so much.
Yeah.